Regardless of what condition or diagnosis you're dealing with in physical therapy, I think there are some common principles that can be applied to all patients. And I think some of these can really help simplify your treatments. But before we discuss anything further, everything in healthcare is gray. Nothing is black and white. There is no one treatment that will magically fix everybody. But that said, I do believe that there are common principles that can be applied to a lot of patients. This is not medical advice, so if you need help, go talk to your doctor or seek out a physical therapist. And I'm also just a new grad PT trying to be better every day, so take my advice with a grain of salt. Okay, if you're dealing with pain, it's better to move a little than not to move at all. Regardless of what you're dealing with, whether it be plantar fasciitis or a small rotator cuff tear, movement is essential. Remember, we're talking big picture, so of course there are exceptions to the rule, but we won't go into detail here. Why is movement good? Because progressive overload. This is one of the core principles of strength training. To put it simply, your body can adapt to greater and greater demands if you slowly introduce load. So here's an analogy that I learned from Jared Hall. He's a super smart PT in Texas, and he also has a continuing education course called Modern Pain Care. I'm gonna put his socials in the description below. So if you want to be able to carry a whole cow up a mountain, you would have to start by carrying a baby calf up the mountain every day. And over time, as the baby calf grows, you'll be able to slowly adapt to that change in weight. And theoretically, eventually you'd be able to carry a cow up the mountain. So you may be wondering, we're talking about rehab here. Why are we talking about cows and strength training? Because if you really look at it closely, all we're doing in rehab is strength training and building capacity. Remember, this analogy is just to illustrate a point. Over time, your body can develop specific adaptations to the load that you put on it, aka the SIAD principle, specific adaptations to impose demands. It's actually quite similar to personal training, but the starting point is just different. Let me explain. The patient walks in, why? Probably because they're unsatisfied with their functional capacity. Maybe they have pain when they stand for too long. Maybe they can't keep up with their friends at the mall. Or maybe they can't run for 5 miles without experiencing pain. Or even in post-op patients, getting them stronger and back to their normal activities. It's our job as the PT to improve their functional capacity and get them back to doing the things they want to do, so our patients can live their best lives. So regardless of how you like to treat, there has to be some type of building up. So if this is the patient's 8th visit and they're still doing the same exercises with the same weights, the patient will probably benefit from some type of progression of that exercise. Number 2, if you're lacking range of motion, also strengthen into the range of motion. Whenever you hear that there's a lack of range of motion, you immediately think stretching. It's true, stretching does increase range of motion, but at the end of the day, you want that range of motion to be accessible. If the patient is unable to control and own that range of motion, what is the point of stretching? So adding on to the first principle, some type of strengthening and stability component needs to be included in the range of motion. In fact, why not kill 2 birds with 1 stone and combine strengthening and stretching into one? For example, with people with calf tightness, a lot of people like to stretch, foam roll, massage their calves. Instead of all that, why don't you just do eccentric calf loading? So just going onto your tippy toes and slowly lengthen your calves. Not only does this give you more range of motion, but it also builds capacity because you're allowing the tendon to work at a more lengthened position. And if you're holding a good amount of weight with it, that could probably produce more force than your hands could ever do with massaging. Just something to think about. Number 3, if you flare something up, decrease the loading temporarily. This is an idea that seems obvious at first, but a lot of the times people don't realize it. For example, if you're a runner that always gets hurt if you run 5 miles, why don't you try to run less? Maybe 3 or 2, maybe do a run-walk program, and then see how you feel afterwards. But the key word here is decreasing your load temporarily, because complete immobilization and just not moving at all is probably not a good idea. But I think it's our job as a PT to really help our patients understand their own symptoms. And we can do that by asking probing questions like, when did the pain start? What do you think that caused this little flare-up of your symptoms? And I feel like a lot of times as you walk them through these questions, they will themselves understand, oh, I probably shouldn't have done that. Or, oh, okay, that makes sense. I think this is important because you're giving the patient the tools to self-monitor their symptoms. A lot of times in PT, people like to do some type of treatment, whether it be manipulation or massage, and get them moving better in that way. But I think this is where we can really make an impact. You can work with your patient as a team and help guide them to understanding their bodies better. So yeah, those are the 3 things that I really wanted to share, and if you have any questions, let me know. And as always, if you found this helpful, like and subscribe, and there's more to come.